why is it so important for me to have long-term care? I mean, a lot of folks will say, will Medicare care of this? And we're always talking about the universal health care that is in the works or partially in the works, but won't that handle it? So really, why is it so important for me to plan for it when I have these other options coming at me?
That's such a great point, Greg, and I think there's so many misconceptions. When we look at the financial plan in general, and you and I have had this conversation a lot, is the idea of the financial planning I like to think of as a three-legged stool. We don't want to outlive our money, we don't want to die prematurely, and we don't want to become injured or sick along the way, which can deplete those retirement assets that we've created. So a lot of times people think, well, my health insurance will cover my long-term care needs, and they don't. The health insurance is designed to cover specific medical costs, but not the cost of the care itself, particularly what we refer to as custodial care. Medicare is basically the same idea. It's not designed to protect against long-term care costs, and what it does protect when there is an illness that's associated with it that is covered under Medicare, it offers very limited coverage. And again, what it won't cover is the typical, what we refer to as custodial care. And a lot of people will also think that Medicaid is another option, but Medicaid is really there for people that are indigent and under the poverty line. So there's no assistance until all of our assets are depleted. We're at a minimum income level, and we have less than $2,000 of assets or less. So that requires a lot of planning to make sure that that might be available. But at the end of the day, none of these are true protections for long-term care. So when we look at, go ahead, I'm sorry, Greg. Go ahead.
No, I was going to say, so it sounds to me like what we do in our planning, with clients, as our financial life plan, as we call it, is really the center of the universe for all our clients. So what we actually come up with is, okay, you really have two options if you have any kind of wealth. And, fortunately, the clients we have do, they don't fall into this poverty level. So you really have to come up with a decision. Can I, pay for it? Or do I self-fund it? And self-funding is an exercise we go through. But, just what you're about to talk about here, what does the cost of long-term care look like to a client? And start with that.
And this is a lot of where that planning goes into place, Greg. It's really just opening your eyes to understanding, where do I want to be when I retire? And if, God forbid, something happens and I do need care, what does that plan have to look like? Whether I'm going to be in my home or whether I would be in a facility. Just to give you scope, these are current average costs. I just basically put New York and Connecticut, so you could get a sense of what the daily average rate for in-home care, for a nursing home care would look like in different areas of New York and also in Connecticut. These are the current rates that are available. These are the current cost of care. Some of these, like in the one in Greenwich, is actually, that's all public information that's available through the state, so you can see specific homes and what those costs are associated with them. The biggest thing is that cost of care is going to continue to be an issue. People live longer. The claims that we're seeing inside of long-term care are lasting longer. Originally, with claims are usually 2 to 3 years. Now they're hovering more between 4 to 6 years. Medicine has no signs of stopping. And these stats are all before you throw in a pandemic and what that has done to the nursing care communities. One of the things that I was mentioning to you earlier, there's a study that just came out from the American Association for Long-Term Care Insurers. They polled 1,000 nursing homes nationwide. 90% of those 1,000 nursing homes have said that they're running at a loss, and 3%, and the other 10% are running at 3% profit margin. So there is a major issue in what the cost of care is going to look like as we continue to go down this road, because these numbers are not going to go down. So as we continue to go through this, so it makes these options just more and more important in our ability to navigate through. So when we look at the idea of a traditional long-term care policy and the life insurance policies, it's really deciding what is important for the client. What is the thing that's going to drive them? Are we focused on long-term care needs? We want to create a pool of money that is just for long-term care. Do we still have a life insurance need? And we want to make sure that if we never need care, that our heirs and our grandkids are going to get some benefit out of the policy that we're spending money on. Or do we want something that is primarily focused on long-term care, but is going to allow us to maximize the long-term care benefit, guarantee our premium, and be able to get that money back if we don't need the care in the future.
Thanks for being with us today, and please follow us on all our social media platforms, Twitter, Facebook, Instagram, and YouTube. We look forward to seeing you on the other side.